Hello everyone. Welcome to the lecture series by the Department of Conservative Dentistry and Endodontics, SRM Dental College, Ramapuram. I am Dr. Srujana and today I'll be talking about the Dental Practicality Index. We are living in times where advances in materials, techniques have all influenced the treatment options, predictability, and outcome. Dental caries being amongst the most common complaints that a patient comes with needs to be dealt with at a very daily basis. However, whether a tooth is salvageable or the choice of the restorative protocol for a particular patient and the truth still remains a paradox. So, the Dental Practicality Index describes the practicality of a restorative treatment. It is an index that describes a framework for assessing teeth and planning treatment. It was published in the British Dental Journal in the year 2017. The Dental Practicality Index is the brainchild of authors who are specialists in prosthodontics, periodontics, and endodontics. Hence, this holistic approach took almost 19 years of time and has been tried, modified, tested until predictable and repeatable results were obtained. So now coming to the components of the DPI, there are 4 components that one has to see when they have to go ahead with choosing the right restorative protocol for a decayed tooth. The first is the structural integrity. The second is the periodontal treatment need. The third is the endodontic treatment need. And the fourth phase consists of the context of the treatment. Now let us understand each and every component of the Dental Practicality Index individually. So coming to the structural integrity, each component has been divided into 4 parts, which is 4 scores are given depending on the availability of the structure of the tooth that we need to see. So scores 0, 1, 2, and 6 are given. So score 0 is given to an intact and healthy unrestored coronal tooth structure, or a tooth that is restored with a well-adapted restoration, which basically does not require any kind of intervention. 1 is the score that is given to a tooth that requires a simple direct or an indirect restoration, and the availability of the tooth structure is adequate for the bonding procedures. 2 is a tooth that requires maybe secondary forms of retention and have minimal sound tooth structure. It could be either due to extensive decay or due to the presence of old restorative materials that have either debonded, are not really bonded, fractured. And the 6 score is given to the tooth structure that is insufficient, which has poor to no free bonding structure. Now coming to the periodontal treatment need, which is the second phase that a person has to see for. Score 0 is given to gingivitis and or calculus which may be present, which basically does not have a major impact on the restorative treatment protocol that one has to choose. Score 1 is given when a probing depth of nearly 3.5 is seen. The patient may have poor oral hygiene. Moderate to severe calculus may be present. In these patients, scaling and root surface debridement may be necessary. Score 2 is given when a stable but limited periodontal support is there. This could be in cases where there is an extensive loss of tooth or extensive falling of tooth which is present because of the periodontal condition of the tooth. Now, the treatment may require either non-surgical or surgical interventions, then a score of 2 is to be given. And the score 6 is basically impractical to be treated. So these are typically untreatable or refractory kind of periodontal diseases which present with advanced bone loss and extreme mobility. Now coming to the endodontic treatment needs, score 0 is given in cases where there is no clinical or radiographic signs of pulpal or the periapical disease. Score 1 is given when a primary endodontic treatment is indicated. The clinician is confident of the prognosis, and there are no complexities that the clinician may come across when he is trying to do a proper endodontic treatment. Score 2 is given when there is a level of complexity that would typically include root canal systems that may have a challenge to prepare, disinfect, and or obturate. Retreatments, iatrogenic error management also fall into this category. And the score 6 is given to the root canals that are not amenable to predictable disinfection and obturation. These teeth may present with symptoms or may be completely asymptomatic, but then going ahead with the root canal treatment of these teeth is not recommended. Now, coming to the context of the treatment, there are two factors that a person has to see. Number one is the local factors, which is pertaining to the oral cavity of the patient. And number two are the general factors, which basically deal with the kind of the patient is, or the patient may have many systemic issues or illnesses that have to be treated prior to going ahead with the treatment of the oral cavity. Now, score 0 is given when it is an isolated dental problem and when a patient presents with a history of head and neck radiotherapy, and the replacement of the strategic tooth is extremely important. Now, score 1 is given when multiple teeth need to be treated, and these teeth are planned as abutments. Immunocompromised patients, patients that are undergoing or have planned radiotherapy of the head and neck region fall under this category. Now, score 2 is given when multiple teeth need to be treated, and all of these teeth have to go under some kind of prosthodontic intervention. High caries rate, poor oral hygiene, parafunctional habits, active periodontal diseases all fall under this category. And number 6 is given in cases where there is a compromised teeth with poor retention and potentially life-threatening medical conditions that basically need a tertiary care. So this is basically the table that has been given in the article. Now, based on the weightage of 0, 1, 2, and 6, and the structural integrity, periodontal treatment requirement, endodontic treatment need, and the context, each and every category needs to be scored. Once we receive scores of 0, 1, 2, and 6, all we need to do is add these up. So basically, the overall DPI score that we receive is obtained by adding all the scores together and of each category. Now, this can be divided into 3 classes. When the DPI is 1 to 2, it is a simple and predictable treatment. DPI 3 to 5, restorative treatment is advisable, but before that, the management of the individual components of the index need to be seen. And DPI, where the DPI score is more than 6, an attempt to restore the tooth is not very advisable, but then sometimes, in some cases, one may go ahead with the treatment of such teeth so as to prolong the life of those teeth and not go ahead with an immediate extraction and replacement. So coming to a few clinical scenarios where we can understand what kind of a treatment should have been taken. So this is a case 1. In this, you can see that the structural integrity is well and fine. So score 1 can be given. Now, a periodontal treatment, the patient is not even present with gingivitis. So score 0. There is no requirement for an endodontic treatment due to the presence of multiple decayed teeth. A context of 1, a score of 1 is given in the context phenomenon. That is because there are multiple decayed teeth and all need to be restored. So total DPI score of 2 is obtained in this case. So the options that are available for the restoration are direct composite restorations. It is our preferred treatment option. So coming to this tooth, we can see that there is one adjacent amalgam that is already present, and a structural integrity of maybe score 2 can be given. Periodontally, it is sound and it does not require any endodontic management. However, due to the presence of the adjacent amalgam tooth and no prosthodontic considerations, a context of 1 due to the local factors is given. So a total of a DPI score 3 is obtained in this case. Now the options that could be available for restoring this 7 is a complex amalgam restoration. A direct composite may not be preferred. However, indirect restorations are preferable in this case. Coming to case 3, now we can see that the structural integrity here, we have given a score of 2. The periodontal treatment is score 1 due to the presence of calculus. Also, there is no need for an endodontic treatment, and the context is also 0. So, a total DPI score of 3 for case 3 is seen. So, now coming down to the restorative options that are available, a complex amalgam restoration, bonded amalgam can be given if the patient does not think that aesthetics is a concern. Also, the longevity and strength of the posterior restoration won't be compromised in these cases. Direct composite restorations are not preferred in these cases due to the higher degree of polymerization shrinkage that would be happening in between the interfaces. It is extremely technique sensitive. However, an indirect composite restoration can be chosen for such cases. Indirect restorations are always the preferable options in these cases. Preferably an onlay can be given in this particular case because we can see that all the cusps need to be capped. So coming down to the case 4, here you can see a class 2 or a proximal decay that is present in one of the in the first molar. So a structural integrity gives us a score of 2. A periodontal treatment need score is 0. However, upon checking with the radiograph, it was confirmed that this tooth needs to undergo an endodontic treatment. Hence, a score of 1 was given. And the context of 1 is given here due to the presence of multiple decay in various arches of the tooth, in both the arches of the patient. So a DPI score of 4 is given. So the options that are available for restoring this particular tooth is endodontic treatment, which is followed by post-endodontic restoration using either fiber reinforced composite or an indirect restoration, maybe an inlay with cusp capping, onlay, or a full veneer crown. However, a full veneer crown should be avoided in these cases because, as one can see, all the 4 walls are intact. So while we sacrifice the sound tooth structure for giving the crown, well, better than that, we can just go ahead with an inlay with cusp capping or an onlay in this case. Now, coming down to the case 5, a structural integrity score of 3 has been given because we can see that a lot of tooth structure has been lost due to the decay. Now, a periodontal treatment need of score 0 is given. However, an endodontic treatment need of score 2 is given. This is because of the furcation involvement that had occurred due to the caries. So, due to the presence of a perforation in the furcation area, first we have to go ahead with the perforation repair, followed by the root canal completion, and an indirect restoration can be preferred in this case. Now, a total DPI score of 6 is received if we see. Now, this is a very technique sensitive case, I would say, because if there is any problem that the clinician feels like restoring this particular tooth could be difficult, in those cases, going ahead with a simple yet a long-term treatment protocol is what is required. So hoping that this dental practicality index helped us all with the choosing of the kind of a restoration one has to go ahead with. Signing off, Dr. Srijana. Thank you.